Hi everyone, so we're going to get started. So we'd like to welcome you to the Building Our Capacity to Do More and Better Patient-Oriented Research workshop. So we'd like to acknowledge that we're on the traditional territory of the Lake Tenay. So I'll do quick introductions. So I'm Tamara Reichert. I'm the Communications Advisor for the Innovation Development Commons at Northern Health.
Just so those of you on the video conference can see, I'm Rachel Wells, Manager of Health Research Initiatives at UNBC and co-lead of the BC Support Unit Northern Centre.
Hi, and I'm Tammy Hofer. I am the Regional Manager for Innovation Development at Northern Health and also one of the co-leads for the BC Northern Centre for Strategy for Patient-Oriented Research.
All right, so we just want to remind everyone that you should have an evaluation form just to write the site name on it, and that the admins at UHMBC and at Mills and Terrace will be grabbing those at the end so they can send them to us. And then also too, if you have any questions, just make sure to push the mic to talk so that everyone can hear you. So we have nothing to disclose. So here's the agenda. So we will get going on the next section, which is introductions, and then to talk about the objectives and then some definitions. So the objectives for today are to define patient-oriented research, explain why patient-oriented research is valuable and beneficial, to identify some examples of when and how to engage patient partners in research, to identify some examples of important ethical and cultural competence considerations, to identify potential opportunities to apply patient-oriented research principles in your research, and then to describe what patient-oriented research resources are available through the support unit and how you can access them. So what do we mean by the word patient? So there's a lot of different words that we can use: resident, client, patient, public, consumer. At Northern Health, we're fond of using person. So the SPORE definition for patient is individuals with personal experiences of a health issue and their informal caregivers, including family and friends. So what is patient-oriented research? So patient-oriented research is defined by the BC Support Unit as research done in partnership with patients that answers research questions that matter to patients and aims to improve healthcare. So PORE builds on a history of community-based participatory research. So how is patient-oriented research demonstrated? So patient partnership means that it's meaningful and active collaboration in governance, priority setting, and the conduct of research, including knowledge translation. And it's also the recognition of patients and the public as experience-based experts who contribute knowledge that is complementary to that of scientists and professionals. So they also have different criteria so that you're engaging patients as partners, which is demonstrated by having patient partners on your research team. Also that it focuses on patient-identified priorities. So the research question or idea is actually developed by the patient rather than it being something that you tell them that you want to know about. It's something they bring forward. It also helps to improve patient outcomes. So that's demonstrated by measuring the outcomes that matter to patients. It engages multidisciplinary teams in partnership with relevant stakeholders. So the team includes patient partners and other necessary voices. So for an example, knowledge users like health system decision makers and healthcare providers. And it also aims to apply knowledge that's generated to improve healthcare systems and practices. So that's demonstrated by the research findings that they'll actually be used in the near term for policy and or practice improvement. So what is patient engagement? So patient engagement means patients meaningfully and actively collaborate in governance, priority setting, conducting research, and knowledge translation. So now on the worksheet, we'll give a couple minutes if you want to list what you learned about the definition of patient-oriented research and its characteristics. Yeah, is there any questions so far? Yeah, it's hard to see.
Does anybody want to share with what they have on their worksheet? Yes, use your mic, Jackie.
Three of the things that were identified as being part of the definition, I guess, were that the research is in partnership with the patients, that it focuses on questions that matter to the patient, and also that it ultimately will work to improve healthcare or policy.
Yep. Any comments from the sites?
I just have a question about the piece of that it will be used to improve care, because if you're doing research, you don't necessarily know what you're going to find. And so this is something I always struggle with when I write ethics applications and they ask me this question, like how are you going to, why are you doing this research and how are you going to use it to make change? I sometimes wonder, how do I know what I'm going to find, and then how can you guarantee it will be used for good, per se? It's there just seems to be a lot of things outside your control with that question.
Good point. I mean, the purpose of the research is to begin to explore and gather the evidence, and if the evidence shows that perhaps it wasn't the right route to take, then you validated that. So it's small tests of change, and sometimes they don't always prove to be the way you want to go. Any other questions from the sites before we move on? Okay, so now we're going to move on to the benefits of patient-oriented research. Just a little bit of background about SPORE and the BC Support Unit. The BC Support Unit is a multi-partner organization created to support, streamline, and increase patient-oriented research throughout BC. So the three of us here today, we are in the Northern Regional Centre, and you'll see that across the province through the BC Support Unit, they have a university and health authority partnership for each region in order to achieve the mandate of the BC Support Unit. And then Canadian Institute of Health Research, CIHR, developed this strategy for patient-oriented research that we call SPORE, a lovely acronym. And so it's about a 5-year initiative looking to extend after 2021. And the focus is really about building the capacity across the country for researchers, patient partners, and health system clinicians and decision makers to engage in bringing evidence into practice, hopefully sooner than we have seen in the past. So why is there a strategy for patient-oriented research? Well, if we consider the context of the continually rising costs of healthcare, the need for current evidence to inform decisions by healthcare providers, health system decision makers, and patients, the literature has demonstrated that it's about an average of 17 years for research evidence to reach clinical practice, and about only 14% is believed to make it into day-to-day clinical practice. So the strategy is here, hopefully, as a way to overcome some of these challenges. Did I skip a slide? Oh, okay. Mine are out of order. So how can patient-oriented research improve the outcomes and the system? Well, when knowledge users provide input on identifying health research priorities and participate in the design of undertaking research projects, when research is conducted in areas that knowledge users value, knowledge users including patients, care providers, health system decision makers, and researchers, and when researchers understand the value of the user involvement and users understand the value of research, then knowledge users will influence and accelerate decision making, translation, and uptake of new practices, leading to an improved patient and provider experience, improved health outcomes, and a more sustainable healthcare system. So you saw I worked my way from the bottom of the diagram to the top. So if you want to get deeper into the background of why we are focusing on patient engagement in health research, there's several articles out there that have examined the value. These are just a few examples of the published literature, and I think we'll be sharing the slides so you can do a deeper dive into the background literature if you're interested. Within this literature, there's several benefits that have surfaced that enhance the quality and relevance of research. That patient-oriented research expands the applicability of research and empowers patients to support better implementation of health research findings in practice. It can increase study enrollment rates. Having patients as partners design how you recruit other patients of similar experiences can help you access that population and engage on a more deeper level. Patient-oriented research can enable, patient-focused research objectives and questions, user-friendly information, questionnaires, and interview schedules. Working with patient partners in those steps of your research design can really increase the value and the applicability to those that you're working to get evidence from. Consumer-focused interpretation of data, and then working with your patient partners and your knowledge users, you really can enhance your translation of research findings, bring it into language that they can understand, that they can see themselves using in practice. It really moves evidence from those journals that were only accessible through libraries into a way that people can see themselves in that knowledge and that evidence you're creating through your research. Of course, patient-oriented research does have some challenges, and in the literature it says that you do need extra time and funding for the engagement. We see now that CIHR has made this a strategy. Some of their granting calls involve having patients as partners on your team. You will want to consider what that compensation may look like to have those patient partners on your team. You think about it, we as researchers and decision makers sit around the table. We're not losing out-of-pocket expenses by participating as a member of that team. We need to be mindful that some of our patient partners should be compensated for their experience and their time on the research project. There could be a worry of tokenism now because this is becoming a new way of working, and we need a patient just to get the research funding. So you want to be mindful of how you engage with your patient partners and make them feel like a valuable member of the team. Again, the struggle with relinquishing control and managing the research project can lead to some conflict, and we do have other resources available through the support unit that go over these issues and help teams work through where these may surface. And then tensions out there in academia for the quality of their research and the user's perspectives. These are all things that come up that have surfaced over patient-oriented research teams, but there are definitely more discussions happening out there in the literature and through the different support units across the country that are trying to tackle how the challenges become mitigated. So now I'm going to hand this over to Tammy to take us into the next session. But any questions before I move on?
Yeah, just a quick question. You mentioned that through patient-oriented research, you develop a lot of closer relationships with patients to foster engagement. And I was just wondering if this would also lead to a higher chance of bias and how to address that potentially through closer relationships with patients.
So the patients that are your partners on the research team are helping you in design and the phases of the research. They're not your evidence. So they're helping with the design and the conduct. You're still gathering evidence from potentially other patients, and they're bringing in their evidence through experience, and then you would use research methodologies, and that's why researchers are such a valuable part of the team as well. They mitigate that bias.
For sure, but in the actual design of the research stage, how to mitigate bias in that?
Well, I mean, researchers are trained in how to develop the methods, and they bring that expertise to the team. That's why you see you have not just patients driving the team, but you bring that team of expertise together, and it makes for a more robust project. So bias is always going to be there. We can't deny that it's going to interject itself into the design because it's a self-interested project most of the time. But there's different strategies and tips that you can be mindful of as the team designs their project. So.
Thank you.
So sorry, my workbook here is a little flipped. You have a worksheet question here to work on. So after you've just heard me talk, can you identify any benefits of patient-oriented research that make you want to introduce patient-oriented principles into your research or improve the way you do it already? So let's give you a couple of minutes to work that through, and then we'll have a discussion. Okay, does anybody want to share their thoughts on this question? Okay. Oh, yes, go ahead. Use your mic.
Basically just from your slides, a couple of the points were that it can enhance the quality and relevance of the research. Also enhance translation, dissemination, and uptake of research results, and interestingly can increase study enrollment rates. Yeah.
Okay, we'll move into the next section that Tammy's going to take us through here.
Okay, so now we're going to get into when and how to engage your patient partners in research, and then of course some of the ethical and cultural competence considerations. So I apologize that this is so small. I'm not sure what it looks like to you out in the site, so it's a little bit bigger here in the room. But what you have here is the research project Lifecycle. And so I'm just going to walk through it and give you an idea of where your patient partners can contribute throughout this life cycle. There's a misconception, if you will, that there are only certain stages where you may engage a patient partner based on maybe their lived experience or their education and background around research. But there is opportunity to engage them throughout the life cycle. So what you'll see here at the beginning, the clinical problem, and then developing your research question, where you can engage your patient partner is around the research question prioritization. So what is the problem that we're trying to address, And then through that, you will come up with a number of research questions, and it'll be important to get your patient partner's perspective on the development of those questions, but also to help prioritize. So as a patient, where would I like to see the focus be in this particular area? Then when you move over to study design, there's an opportunity here for your patient to help develop outcomes. So select patient-oriented outcomes. Many times the lens that the healthcare decision makers, clinicians, and the researchers bring is different than what are the important outcomes to patients. So for example, you might want patients to be able to move through the system faster, whereas me as a patient, the outcome is I don't necessarily need to move faster, but I need to know where I'm going, and I need to know how to address the gaps. I need to know how I can access care, or maybe I want to be able to not take this drug anymore because it makes me very tired and I can't play with my children anymore. So there's lots of different outcomes that are important to patients, and it needs to be considered when you're designing your study. So then we get into funding. Here your patient partner can help develop funding applications and become a co-applicant. So as Rachel mentioned, CIHR and many health funders are now looking for active patient engagement on your research team. So again, moving away from that tokenistic participation to actually having the patient partners named on your team and part of developing your application. Then with respect to the study setup, they can join the study steering committee, assist in developing and the data collection forms. So this will be important, especially if you're engaging other patients during your research, because they bring that lens, that perspective, that language, which will be important and translatable to other patient partners. Ethic approval, so you were talking about biases. Engaging the other researchers and healthcare decision makers is important in understanding where those biases might show up, but also engaging your patient partners in that. And what they can do is help develop strategies to troubleshoot where those ethical considerations or biases are. The conduct of the study, again, developing some strategies around that. Analysis, so helping with assist in data analysis. They may not have a degree that in statistical analysis. However, again, the reason you're engaging them is to bring that perspective from the patient. So how do I interpret what you're telling me that will then be translatable to other clinicians and patients within the system? Interpret the findings, again, contributing to study results, so helping with that knowledge translation piece. Circulate the findings, so maybe thinking of other plain language or venues or networks in which that research could be important in getting out there. And then again, in policy change, so shaping changes in local, national, and international policy. And again, change in practice. Many of the things that we ask our clinicians to provide to patients, in the end, it's really up to the patient whether or not they're going to do it. So you can prescribe me a drug, you can prescribe me an intervention, but as the patient at the end of the day, I will determine whether or not this intervention is successful. So engaging patients all the way along that spectrum in order to ensure that that change gets into practice. Even being an advocate and being able to go to their clinicians and say, I'm aware of this, this is what I would like. Okay? So patient engagement considerations, Rachel spoke briefly to some of the challenges. So it's important to watch out for some of the pitfalls that may occur when you're engaging patients as partners. So it's important to give yourself enough time to plan how you want to engage patients at the start of your research study, because again, involving them later on in the process could be perceived as tokenistic, but also it might mean that you miss out on some very important pieces with respect to how CIHR defines patient-oriented research, and literally it's not just one of those 4 or 5 things, it's all of them. All of those areas need to be covered. So some of the things to be aware of is engaging patient partners as early as possible in that process, identify patient partners with lived experience related to that topic, and considering their ability to participate. So what's their lifestyle, accessibility, access to technology, familiarity, readiness for research, language. Language is so important, and I can say after 21 years of working in healthcare, we love our acronyms. So we really need to be careful on how we use language and how we try and engage people and meet them where they're at. Consider how many patient partners should be included to ensure breadth of perspective. So, once you've communicated or engaged with one patient, you literally have only communicated and engaged with one patient. So keep in mind that one patient does not represent all with that lived experience. So think about your research study and the depth and breadth of which the patient partners that you need involved in that. Communicate clearly and in plain language the patient partner's role, the level of engagement. So when I say level of engagement, there is the International Association for Public Participation, the IAP2 spectrum of engagement, and that's all the way from inform to empower. So it's inform, involve, collaborate, empower, I think I missed one, consult. So there's a whole spectrum of engagement. It's important when you're engaging others in anything, including research, that you're very clear at what level you're engaging them at so they understand the expectation in which they're being asked to be involved. So for example, if you really are just looking for feedback or to consult, and you have not communicated that, and there might be an expectation from your patient partner that you are collaborating or empowering them. So it's very important to be clear about that up front. You need to be able to plan for patient orientation. So who will do that? What does that orientation look like? What will be included? Do you need them to travel? Do you have a diverse patient partner team from across perhaps the north? How are you going to get them together, and what kind of orientation are you going to provide? As a side note, I will say through the Northern Center, we do have access to the National Curriculum for Patient-Oriented Research, and we do facilitate those 3 modules for newly formed research teams, as well as folks who have a general interest in patient-oriented research. So that is a great mechanism to use for an orientation. Yes, Jackie.
How long does that training take? You said there's 3 modules?
There are 3 modules, and if you were to do it in its entirety from start to finish, it's between 2.5 to 3 days.
Okay.
However, I will tell you that we have been able to bring it down into 1 day. So it really depends, I guess, on the level of orientation and knowledge that you need to impart on your team. We try and pull from the curriculum the relevant parts, so lots of connections with you and your team in advance to see where you're at in your relationship, because sometimes the teams come to us and they've already been working together for a little while. So I think we have the ability to tailor it, but then finding that balance is we don't want to do a disservice either. So providing you enough to build your team, but mindful of the fact that not everybody can come together for 3 full days. You're welcome. So there are ethical and cultural considerations that you need to be very, very mindful of during your planning phases. Safety, privacy, language, scheduling. You need to consider the power dynamics and the patient partner's potential experience of stigma or fear or consequences. So, a good example I actually heard from a practicing physician was, so I guess probably while I'm doing a patient visit would not be the good time to say, hey, would you like to be part of my research study? Probably not. There's probably a feeling of vulnerability in that moment. There are things to consider about the power dynamics. Especially in the north, we have a lot of communities where there are only 1 or 2 GPs, for example. And so you have to think about if I'm the only GP in this community and I'm trying to engage my patients, am I potentially putting in a power over imbalance in place here? Because will they feel comfortable in saying no to me and worry about repercussions of the care that they're going to get after that? So just some considerations. Avoiding tokenism through effective engagement as a partner. So again, the more upfront in the process that you can engage your patient partners, the more authentic that engagement will be. And consider the potential barriers. Does your patient partner have physical limitations, cognitive, emotional? Perhaps there's some trauma from past experience that you need to be mindful of as you're engaging them. You don't want to re-traumatize your partners. Consider cultural norms and appropriate engagement. Many different cultures have different ways in which they want to be engaged, or it's appropriate to engage them. And again, considering the heterogeneity within cultural ethnic communities, aka diversity. So like I mentioned earlier about when you've consulted one patient, you've consulted one patient. It's the same thing within the North. You consult with one First Nations community, you've consulted with one First Nations community. Every community is very different and their cultural norms are very different. So be very mindful of that. And then considering patient partner compensation and reimbursement of expenses, again, planning for that upfront in your process. There are some guidelines that we have within BC to help guide you around patient compensation and reimbursement. So we're happy to share those with you as you're building your research plans, that you can build that into your budget. But be mindful that to ask people to give up their time free of cost is not fair or ethical when your staff are being paid, your healthcare decision maker and partners are being paid to be there. So another consideration. So next is the part where you get to reflect on a whole bunch of things that I've said to you, and hopefully some of it stuck. So take a few moments and think, what are some of the considerations that you will take into account when you next engage in patients within your research? Now, not to put the sites on the spot, but I will, just because I'm mindful that you probably have not been given a lot of opportunity to share. So if there is someone at our Mills site or UHNBC that would like to share some of your ideas, please feel free.
Sure. I think one thing that after looking at your slides, I thought about was engaging earlier in parts of the planning process. I thought maybe a patient partner wouldn't be interested in or isn't appropriate. Like you can't engage and say, like, even just getting an okay for thing, I think develops that identity as part of the team and having an important say. Even if, it might not be interesting to them to do the funding or the ethics, it might be still good to have patients engaged at that point in time too.
Yeah, that's an excellent comment. And having had the opportunity to work with a number of patient partners, never make any assumptions about where they will find their interest. Many of them have had this lived experience and are very passionate and want to be part of this process and learn as much as they can. So never make any assumptions about where they might get benefit or find interest, and always leave it for them to tell you where they want to be involved.
That's 100%, because I don't find those parts of the process terribly exciting, so I wouldn't want to ask someone else to have to do them. But you never know, maybe some other people like that.
That's right, that's right. Anyone else want to share? I'm an extreme extrovert, so I've learned to like be quiet for a minute and let people contemplate and give you time to respond. All right. So last but not least, a discussion on applying patient-oriented research. So again, this is an opportunity for you to do some thinking. So here I'm supposed to remind you of an example used to illustrate the definition of patient-oriented research early in the workshop. And note a research project that you have done, are doing, or are considering doing in the future in which you could apply patient-oriented research principles. So I'm almost wondering if it would be beneficial to go back to that slide so that... That's the one we did. Oh, that was the one we hid. Our bad. We hid a slide from you, and so that's not particularly helpful. However, you have been given lots of information, and I have faith in you that you can think of what you've heard so far and how you might consider applying some of these principles. Yeah, so I'm just being reminded, so as a Northern Health employee, I have the benefit of working with many healthcare decision makers and clinicians. And when I talk to a lot of clinicians about getting involved in research, sometimes I get like deer in the headlights. I'm too busy for that. I have a full-time practice. I'm not really into research. And so I've been working a lot, and same with Tamara and Rachel, with our partners to really start bridging the gap between quality improvement and research. Because lots of times when I say quality improvement to clinicians, that seems to resonate more. And it really is about making improvements in care and in our system for the benefit of our patients, and that should be evidence-based. So thinking about it perhaps even from a quality perspective, how you could engage patient partners in improving the care or the system in which they find themselves in and in which you find yourselves providing that care, and how you could use evidence to support that. And then, of course, no presentation is worth its weight if there wasn't a call to action. So the last question is not only what have you learned, but what goal are you going to set for yourself with respect to what you've learned today and how you're going to potentially put that into practice. So I'll just give you another minute, and then we'll do a debrief. So would anyone like to share their responses to these questions? Some people are still writing, so maybe they're not ready yet. Okay. Anyone from our UHNBC site? We haven't had an opportunity to hear from you yet.
I think after this workshop, I'll take the opportunity to go and learn about some more patient-oriented research projects locally, and this is kind of my first exposure to this, and learn about the different settings in which this can be applied to.
Great, thank you. And we will share with you some resources that you can access to help you with that. Anyone else want to share before we move on?
I can share. My goal was to, I'm currently working on a patient-oriented research project, and I'm going to share with my supervisor that there are these modules that can be done as like a team, so that the whole team can maybe better understand how the research is supposed to work.
Great, thank you very much. Good, all right, I'll pass it back over to Tamara.
Thanks, Tammy. All right, so now we'll go into the final section, which is talking about some tools and supports and resources available through the BC Support Unit. So the BC Support Unit has a lot of different services. So the services include helping researchers develop patient engagement plans that cover how to effectively recruit, train, and support patients to become part of a research team. They also offer training, including webinars, online resources, workshops, and an annual conference. They offer online resources with self-directed learning. They also facilitate the use of REDCap and our REDCap for Poor projects. They also provide training and resources to help build your knowledge translation capacity and also help review KT plans to ensure they are aligned with best practices. They provide consultation and support for patient-oriented research questions and assist with data access and related data services. They also provide consultation on pragmatic clinical trials, including assistance with trial design, and offer advice on how to make your trial more pragmatic. They can also offer letters of support for research proposals that align with goals and objectives. They help facilitate the creation of the electronic communities of practice, which is a password-protected workspace which enables collaboration from anywhere. And then there's also the National Curriculum for Patient-Oriented Research. So now here's a look at the homepage for the BC Support Unit website. So if you click on the inquiry form when you're on the home page, that's where you can actually get to accessing the different services by submitting an inquiry form with the unit. So there's different services listed under the inquiry form. There's patient engagement, training in patient-oriented research, knowledge translation, research methods support, letters of support, ECOPs, and then pragmatic trials. So their website is easy to find. It's just www.bcsupportunit.ca. So now if you were to, when you're on the home page or on any of the pages, click on the top in the menu bar where it says resources. You can actually have a couple options. It doesn't show it on here, but if you scroll down, there's a search function where you can search all the different resources. So you can search by who it's geared towards, what the topic is, what kind of medium it is, whether it be a webinar, a video, a journal article, and much more. Or if you actually just scroll down, you'll see the most recent ones that they've posted. So they do, quite frequently, they do webinars, and they always have the recordings posted there as well. So you can access them at your leisure rather than having to attend if you don't have time to attend when they're actually happening. So they also have the electronic communities of practice. So they are a secure format to be able to collaborate with your research team and I believe it's housed in Canada, so it's secure. And unlike an intranet or some other platform, it's something everybody can access as long as they're given a login and a password. Then they can all access your specific ECOP. So if you are interested in connecting or collaborating with others and accessing some more tools, resources, and information, just click on the Become a Member, and then it'll be a form that you can fill in to request access. And then you can also start using the ECOPs if you would like to with your team. All right, so now we're on to the last section with Rachel.
It's okay, we have time to do it here. So we're just going to review the objectives that we went over today to see if we've achieved them. So we wanted to define patient-oriented research, explain why patient-oriented research is valuable and beneficial, identify some examples of when and how to engage patient partners in research, identify some examples of important ethical and cultural considerations, cultural competence considerations, identify potential opportunities to apply patient-oriented research principles in your own research or projects, and then describe what patient-oriented research resources are available through the BC Support Unit website and how you can access them. Do you have any questions on the material we've covered here so far? Today, I just wanted to acknowledge that it is a high-level overview, and the BC Support Unit offers the foundations for patient-oriented research to do a deeper dive in the background and context in some of these principles and team development. Just wanted to make a bit of a plug for, I think it's the one woman there in, is it Terrace? Are you at Mills right now?
Yeah, I'm in Terrace at Mills.
Okay, so we will be in Terrace on June 8th. We're hosting a research skills development workshop. Denise Jarowski, Dr. Denise Jarowski is the host, and we will be doing one of the foundations of patient-oriented research workshop. Tamara, who was just standing here, will be there, as well as patient journey mapping with some of the physician QI coaches. And it'll be at UNBC from 9 till 3:30 on June 8th. So I'll give you our contact if you're interested in attending. We definitely welcome you to go to that.
That's awesome. I'm in touch with Dr. Jaworski. That's who I'm working with on my project. But unfortunately, I'll be out of town at that point in time, so I won't be able to make it.
Okay, well, then I'll make another plug. We will do more of this in the fall, at least at UNBC, and we always try to offer any remote access into our workshops and our presentations if you're interested. So I'm going to make a plug about the evaluation. I think there's a survey in front of everybody. If you don't have one, please let me know. We can get that to you electronic. The Department of Faculty of Medicine at UBC partnered with the support unit to design this session for you, and they're really interested in hearing your feedback, as well as the BC support unit on the content and perhaps what else you would like to see the support unit offer. Yeah, go ahead.
Just a quick question. I apologize. I might have missed this earlier, but where are those modules accessible for additional training? Thank you.
Through the regional centers, so through us. You can, oh, hold on, let me get to the next slide here. So you can write this down. So here's our email addresses. We also have a Northern Center email.
Yeah, it's just Northern Center at Northern Health.
So you can type in Northern Center at northernhealth.ca, and you can be in touch with us that way, or you have our individual emails here on the slide. As well, from UBC, Gabrielle Rose is your contact about this particular module. And then, sorry, go ahead.
On the support unit's website, we have a Northern Center page.
And we have a Northern Center page on the BC Support Unit website. And I encourage you to go back to the BC Support Unit website and dive into their resources tab. There's a wealth of webinars and info pages and references to literature that is very helpful especially if you're writing grant applications or just wondering how to even start working with patients as partners on teams. One of the modules, if you do have a team that's ready to go, we offer a workshop that does a deeper dive into, really a team contract over the life of the project that helps you sort through the storming, norming, forming steps of team development. You can really unpack and mitigate some of the issues that might come up over a research project in advance. So any other questions from the sites? Okay, well, we'll be circulating the slides. We have your contact from those in the room today. Any questions, please feel free to just drop a note to Tammy, Tamara, or myself. And we're here really to help you in your development, in your capacity for doing patient-oriented research. So at least for the next 2 years, we have people dedicated in the North to support this work. Thank you.
Thank you.